All right, so I'm here with our patient today, and she is 1 week after her septal rhinoplasty, and so you had some functional problems and then also some small cosmetic tweaks we worked on.
Correct.
So I guess just in general, speak to what the recovery process was like. What was the hardest part?
Um, the hardest part was probably sleeping, just because of congestion. It was like having a bad cold. So when you have a bad cold, it's difficult to sleep. But honestly, you had told me that it wouldn't be painful enough that I would need any kind of serious pain medication, and that Tylenol is sufficient, and that turned out to be true for me. I had a regimen of Tylenol, every 6 to 8 hours I would take my Tylenol, and it really was enough to take the pain. There really wasn't a lot of pain. It was more congestion for me, and obviously tenderness to the touch, right? If I were to touch my nose, there was tenderness. But it wasn't extremely painful.
Yeah, and I would say that's really typical for people to tell me that. It feels like a bad sinus headache.
Correct.
That tends to linger. And usually right around this weak point, everything sort of flips and swelling gets a lot better and over time. And you'll see we have a few tapes in place, and that's basically to just help egress some of that swelling that's stuck on, and so she'll be doing that at home. How about the bruising and going out? Did you go out and do your normal stuff, or?
So my surgery was on a Friday, and so I tried to stay home around the house all weekend long. My husband and my daughter went out and did activities, but I tried to stick around the house a little bit. But I was able to, I checked my emails and did some work-related things as I normally would do, but just kind of took it easy. I didn't go crazy trying to go to the grocery store or anything like that.
Yeah, that makes sense. That's great. Anything that you wish you knew going in? Might be a harder question, but.
I wish I'd known that I would have a bad headache.
Okay.
And again, I think you accurately described it as like a bad sinus headache, a pressure headache. I had a headache after the surgery, the first night and into the second day. So I wasn't expecting that, but it makes sense in hindsight because you're working on the sinuses that you would have like a sinus headache.
Yeah, that's what it's the swelling. It's not even that there's anything that's done back there. It's just that all that swelling coming in kind of generates this congestion, and that makes you feel stuffed and blocked. Well, thank you so much for sharing. It's really nice. I'm really excited for you. I think as this swelling comes down, it's going to turn out perfect for your breathing and also the appearance.
I'm excited.